How are COVID-19 deaths being counted? Let's get straight to the source. Here's Ngozi Ezike, the director of Illinois Department of Public Health.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. Technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
COVID-19 is a virus. I understand. I get it. But when you falsify the deaths of people that say they died of COVID when they actually died of other underlying issues, they died with COVID, not because of COVID. And to put a vaccine into my body that hasn't been tested, it's not happening.
The intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Now, the issue is that the way it's being counted at the moment means that if you are diagnosed, you test positive for coronavirus, even if you go into hospital, but then you recover and you come out, and then 2 months later, say, or a period of time later, you then die of something completely unrelated to coronavirus, your death will still be added to that coronavirus death tally.
And you know the memes. The memes are already, you fall out of a plane without a parachute, you died of COVID-19. You get shot in the head, you died of COVID-19. You had a heart attack, you died in a motor vehicle accident, you tripped down the steps and hit your head and died, you died of COVID-19. These are memes, but this is literally happening. Literally happening.
People who've got COVID on their death certificate, it doesn't necessarily mean they were infected because many of them haven't been tested, so we just need to understand the difference.
The state counts every person who tests positive for COVID-19 and then dies, even if the death was not caused by COVID-19.
To be honest with you, all of the death certificates they're writing COVID on all of the death certificates, whether they had a positive test, whether they didn't.
This isn't like, we're not the first case of this happening.
Oh, absolutely not.
How often do you think this has happened?
Quite a lot. Quite a lot.
What I learned is that the numbers that we are being reported are completely bogus. They are meaningless. They are worthless. Not a single county in the state, perhaps, I don't know if all states are doing it this way, but perhaps not a single state in this nation can tell you they know how many people are hospitalized, in the intensive care unit, or dead because of COVID as opposed to with COVID.
The initial story is about Matt Hancock, who is the Health Secretary for the United Kingdom. So this is a person from government that is making these statements. I am not making these statements. Matt Hancock has called for an urgent review into the way Public Health England counts coronavirus deaths. A scientist has said that they are over-exaggerating the daily coronavirus death toll.
Up the numbers?
Very much so.
How do you know?
Because I work in the emergency room. They talk about the front line like I'm literally in the front lines. I'm seeing it. I worked 13-hour shift yesterday. People die all the time. But now if somebody dies of a respiratory issue and they didn't test them with COVID, they're saying COVID. They put it on their death certificate, which is bullshit because I'm the one saying like they didn't even test with COVID. So yes, they're hyping the numbers up. Easily to hype them up.
I'm on the trauma center down at Kings County. Death set, we're saying everybody who dies has coronavirus on their death certificate. Everybody who ends up having anything to do with this coronavirus on their death certificate.
And oh, by the way, don't you think it's really interesting if you look at the stats of how not right now all the COVID-19 coronavirus deaths are rising? Guess what's dropping massively? Deaths from pneumonia, deaths from the flu, and deaths from heart disease and heart attacks. Don't you think it's a bit ironic? What, are people not dying from heart attacks anymore? Are people not dying from pneumonia? Are they not dying from the flu? Nope, apparently COVID-19 and coronavirus fixed that. So now every person that dies now, for the most part, is getting labeled toe tag with COVID-19 coronavirus. Think about that, Pete.
I want to reassure everyone that every single person who has COVID-19 listed anywhere on their death certificate is in fact counted. And even if it's not listed on their death certificate, anyone who has a COVID-19 positive test within a certain period of when they died is also counted as a COVID-19 positive death. Lastly, we have a system in Maricopa County where if somebody dies in their residence or at home and we don't know why they died, if there's any suspicion that there was any respiratory illness at all, we actually send someone from the medical examiner out and do a COVID test post-mortem to make sure that they're being included in our death count.
They're not talking about the high blood pressure, the diabetes, the stroke. They say, did they die from COVID? We've been to hundreds of autopsies. You don't talk about one thing. You talk about comorbidities. Their vessels were narrowed. Their lungs were a smoker. COVID was part of it. It is not the reason they died, folks.
Which means you died in the presence of the virus, but the virus didn't cause your death. When they started looking at the data from that perspective, what they found was like 98 or 99% of people who died did not die from the virus, they died from something else.
Non dite anche qui 25.000 morti, non è vero, non usate i morti per retorica e per terrorismo. I dati dell'Istituto Superiore della Sanità dicono che il 96,3% sono morti per altre patologie. Esattamente i dati, i numeri, dice questo, è la verità, è la verità.
There are 18 people in hospital, for God's sake, across Australia, and there are about 8 people in intensive care. Now, honestly, we're sweeping people up into a sense of hysteria and alarmism. There are more people dying from the flu with a vaccine than are dying from coronavirus without a vaccine.
I've been filling out death certificates for over 30 years. To reiterate, if a patient tests positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list this case as one more COVID-19 death, and they go to the next questionable death. They label that as COVID-19, and it goes on and on. You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database. Those false numbers are sanctioned by the CDC as of their memo yesterday, April 4th. I have made physical copies of those memos in case more people start looking at their website and they decide it's too much truth for us.